Preoperative endothelial function and long-term cardiovascular events in patients undergoing cardiovascular surgery. Via latest results for heart and vessels. Abstract. We recently reported that preoperative endothelial dysfunction, that is, reactive hyperemia index, RHI, less than or equal to 1.64, predicted short-term postoperative adverse events in patients undergoing cardiovascular surgery. However, the relationship between preoperative RHI and long-term cardiovascular risk in these patients is unclear. A total of 195 patients with at least 1 year follow-up who underwent cardiovascular surgery were included. Preoperative endothelial function was assessed by RHI. The primary outcome was a composite of cardiac death, stroke, myocardial infarction, rehospitalization due to heart failure, and any coronary revascularization. 19 patients, 9.7%, met the primary outcome, including cardiac death, N equals 7, stroke, N equals 5, heart failure, N equals 9, and coronary revascularization, N equals 2. During a median follow-up of 20 months. There was no significant difference in the baseline characteristics between patients with RHI less than or equal to 1.64, N equals 86, and those with RHI 1.64, N equals 109. The primary outcome occurred in 13 patients with RHI less than or equal to 1.64, 15.1%. And in 6 patients with RHI 1.64, 5.5%. Kaplan-Meier analysis demonstrated a significantly higher incidence of the primary outcome in patients with RHI less than or equal to 1.64 compared to their counterpart, hazard ratio 2.94, 95% confidence interval 1.12 to 7.75, p equals 0.02. Multivariate analysis showed diabetes and RHI less than or equal to 1.64 as independent predictors for the primary outcome. In conclusion, preoperative endothelial dysfunction assessed by RHI was associated with long-term cardiovascular events in patients undergoing cardiovascular surgery. Add tags, currently, uncategorized, #medicine by Alexandros Sfakianakis, #ola by Sfakianakis G. Alexandros.